Heat waves and rising temperatures have major health implications, particularly among vulnerable populations and low-income areas across the continent. Now, data science methods can identify promising interventions and optimize programs to reduce the impact of climate change. The Heat and Health African Transdisciplinary Center is developing solutions to mitigate the health impacts of climate change in Africa. Joining me to tell us about the study and the impact of climate change on women and reproduction is Matthew Chersich, who is co-principal investigator at the Heat and Health African Transdisciplinary Center at Wits University. Very good morning to you. Thank you so much for joining us. I think now more than ever, the issue of climate change has become a focal area, as a lot of people during COVID-19 have had time to really sit back and analyze so many differences in weather and the contributors to impacting climate change. And your study speaks to reproduction and women. Tell us more about it.
Thanks, Paul. So we've got a 5 to 10 year grant. It's by the National Institutes of Health, the largest research fund in the US. And basically, like you said, we're going to use data science, which is really to reuse data that's been collected across the continent. We have partners in East and West Africa, as well as some in the US. But it's really an African-led transdisciplinary. So we're working with climate scientists, so the people who predict the weather, but also understand the weather. So this is the meteorologists, social scientists, and data scientists. Those are really the forefront of mathematical, machine learning, artificial intelligence. IBM is a partner. So basically, we take a whole range of data from across the continent and analyze. And this is one of the first. So there is a lot of data across Africa, and it hasn't really been taken advantage of to understand health and to understand climate change. You know, we have a good sense of the impacts of climate change in the northern countries, but in Africa we really don't know enough yet about how climate change, especially heat waves, affects pregnant women and people in urban areas, particularly informal settlements, for example. We don't know that, but our centre will hopefully add a large body of knowledge to this.
Heat waves and rising temperatures specifically have the most impact when it comes to the pregnant women and that space. What exactly is it that needs to be known, and perhaps which you may send out a word of caution to ensure that there are some solutions to mitigate the health impacts?
So we know already quite a lot, like I said, from northern countries, but we're beginning to understand also in South Africa, in some pilot projects, we begin to kind of explore this in more detail. But essentially, throughout pregnancy and in particular during childbirth, heat is a major problem. And so there's at least 250 studies across the world that have shown this, particularly with things like preterm birth. So when it's hot or heat wave, the factors that cause labor to initiate are particularly advanced or strengthened. So preterm birth, stillbirth associated, heat during early pregnancy can lead to congenital anomalies. And I think during childbirth is the key moment. We're here for about 10 hours. There's this intense heat production by uterine contractions. Any pregnant woman who's been through childbirth will understand this. There's a large amount of heat and exercise really for 10 hours. So if you're a woman who's delivering in a labor ward that has no insulation, the roof is made of steel, sometimes there's limited water available, and it's 4 or 5 degrees warmer indoors than outdoors, you really are in trouble. Labor is prolonged, much more infections, bleeding. So and heat waves in particular are a very large threat for pregnant women. And the reason there's uncertainties around this is that women in high-income countries, they deliver in a labor ward where there's air conditioning. But it hasn't really been studied. What happens to a woman during labor for 10 hours in a sauna, for use of a better word.
And what are some of the different indicators that will essentially point to some solutions on this, and perhaps alerting pregnant women so that there is some knowledge on these limitations?
So that's fantastic, because that's a great question. What we really are trying to do is to document impact. But, I think everyone has a sense, or everyone should have a sense that climate change has impact. The areas of the world are no longer workable, and many areas are no longer livable. But I think people have a good sense that climate change has severe impact. So, we don't want to just look at impact, because that doesn't really help to advance the agenda. It does help to highlight the need to stop coal and other harmful coal burning and other harmful practices. But we really need to move beyond the measuring impact to say, okay, now what can we do? So in our study, we try to define at what level, what temperature does heat become dangerous for pregnant women and the fetus or newborn. So we imagine it'll be somewhere around 24 degrees. So above 24 degrees, and in an urban setting, it might even be 23 because of urban heat islands. But we'll be able to understand with quite good precision at what temperature you start getting these adverse events. And at that point, when we have that understanding, we'll be able to issue warnings, through Newzroom Afrika, through various media, and in fact through social media and apps that our teams have developed. You'll be able to quite precisely say, if you are an informal settlement and it's 25 degrees tomorrow and you're pregnant, we need to protect you, and you warned, and a set of interventions are needed to help you. So it's really also trying to be practical.
The background of your work speaks to vulnerable populations in low-income settings in Africa. And given what we know about South Africa specifically, and access to hospitals in the rural areas, and a lot of challenges around that space, how then will your work perhaps make a difference in helping government officials, particularly in the health sector in South Africa, where we have seen under COVID-19 how much work and where the loopholes are in the health system in the country?
If I knew the answer to that question, me and my team could retire. But really, I think maybe if I could put it this way, that the whole field of climate change and health is quite new. We've had centuries of studies on nephrology, neurology, anatomy, maybe 2,000 years or more of knowledge on other disciplines in health. But the field of climate change and health is really, really new. And Wits is at the forefront of developing this new field, which needs to become a speciality in health, like any other that I've mentioned. So as that field starts to develop and we start to present solutions, then government, but also agencies, international agencies would begin programs. So in a similar way, the way we're hoping this will play out is that in a similar way that when HIV became clear to the world and to the government that HIV was a massive problem and really the largest threat to health in the early 2000s. So we're hoping that once we've developed solutions, and then as the government and international agencies become aware of just how large this threat is, this is a threat to the very planet, that you will then start to get appropriate responses. Some of the practices of this government would really be then clearly seen as inappropriate, but in terms of emissions. But in terms of what we'd like, and this is what we will start testing a little bit later this year, is you get health facilities and you do modeling. It's called thermal modeling, which I don't fully understand, but basically, it's not my area of specialty. Yeah. You get a health facility and you assess it, what is the airflow, is it natural ventilation, would one air conditioner midway down the wall be useful? If we painted the roof with reflective paint, what would happen? Mm-hmm. Is cold water perhaps the only solution needed? But basically, you do quite smart thermal modeling and emission modeling. the major causes of emissions, and then you implement that. So within this facility, you would then implement a package of interventions to make the facility suitable, livable, birthable, for a better word. And then hopefully government and others would come in and say, look, you've identified a problem, you've noted a solution, you've shown the solution works, and let's get stuck in. And it's, I think you started this conversation by noting that people are becoming aware that climate change is the greatest risk to health, to the natural world, which we are charged with protecting, and to the world itself. And as this becomes more and more apparent, how many more cyclones do we need before we realize? How many more droughts in Cape Town, day zeros, do we need before we take it seriously? But at some point we will, and at that point there will become funding available, and hopefully we'll paint all health facilities white in the country. And that's not an expensive exercise. Yeah. But it would be life-saving in many instances.
Now, as you conduct these tests, how will you then assess what will influence your systems? I mean, you make mention of the early warning system. What will that essentially mean?
Well, we're still trying to understand some of those problems, but we will, as scientists and researchers, we build in ways of measuring if our interventions are working. So we also importantly need to work with communities. People often view heat as a nuisance or as a source of pleasure if you have a swimming pool or something like that. But to kind of work and understand those perceptions, and then how are we able to communicate the risks of heat. But people living in informal settlements and pregnant women, those groups are perhaps most aware of those things. But we really would find ways of evaluating and making sure that our services are working. And it's quite simple in some places. If we did transform a health facility like I just spoke about, and you measured the duration of labor, and if it was an hour or two shorter than it was before your intervention, then you've got a good sense that it works. So it's not really, we're not trying to prove, we're not doing anything very complicated.
Yeah.
So we can show effect. Particularly if we're better resourced. If the centre continues to obtain resources and are able to show this, then we're away.
Yeah, absolutely. Thank you so much for your time and really giving us some detail around solutions to mitigate the health impact of climate change. That was Matthew Chersich, co-principal investigator of the Heat Centre.